Welcome to another session of Technology by Performix. I'm Ken Umansky, your host, and today we're going to take another journey into the world of technology. I'm fortunate to have with me two guests, Kevin Spielman, COO and Chief Innovative Officer, as well as Susan Costello, PhD and RN. They are both with Perfect Shift, a software platform primarily focused on workforce management optimization, particularly within the healthcare sector. Kevin is the creator of Perfect Shift platform of tools that ensure the cost-effective delivery of high-quality healthcare. It automates the key business processes and pairs them with key information that is delivered by the latest technology. Kevin has years of senior healthcare leadership experience at companies such as Cardinal Health and was co-founder of HealthJobsOregon.com. Susan is a respected nurse leader and a seasoned healthcare executive with more than 30 years experience. Her career has been focused on sustainable financial, operational, quality improvement, as well as cultural transformation. Prior to joining Perfect Shift, she led service expansion, business development, financial, quality, and service performance at Lucile Packard Children's Hospital. Well, I want to welcome both of you today to technology, and I know you're in different parts of the country, and I hope you're staying warm.
Thanks, Ken.
You both are very accomplished in the healthcare field and have married that experience with technology. I'm really interested, I know my audience will be, in understanding how you've made that work. So let's just get started. Let me ask you a first question. Can you provide an overview of the Perfect Shift and how its primary objectives in healthcare workforce management? Let me state that again. That wasn't really clear. Can you provide an overview of Perfect Shift and its primary objectives in healthcare workforce management?
Sure, Ken. Really, at its core, Perfect Shift exists to improve how frontline leaders manage their respective business units. Our mission is to equip them with education, tools, and real-time information that they need to run their operations more effectively. As a cloud-based solution, Perfect Shift eliminates the burden of manually compiling reports from multiple disparate sources of information, such as electronic health records, timekeeping systems, ERPs or enterprise resource planning and human capital management systems, financial systems, and even direct input from frontline staff. Instead of waiting for end-of-month or biweekly reports, leaders get the data they need in real time to make informed, proactive decisions.
So what kind of companies or organizations are you really primarily focused on and working with?
Healthcare workforce management is full of inefficiencies, and we've identified four major challenges that Perfect Shift solves. First is the data deficit. Too often, the right people don't have access to the right information at the right time. Perfect Shift ensures that decision makers have real-time data at their fingertips, empowering them to manage their teams proactively. Susan, you want to address the next three?
I will, and I also want to sort of address Ken's question about who do we work with. And so we work with hospitals of any size, community hospitals, large hospitals, academic medical centers. But within those, we also work with ambulatory settings, ASCs, or ambulatory surgical centers would be within our scope, large physician practices, but folks who have a multi-dimensional organization that needs to have the data that they're getting about all of the components of their organization integrated. We work with one of the groups of folks who most seriously benefit from the system are the folks who are at the front line, because most of the data sources are enterprise-wide, and so rarely have contact with the folks who are providing the service. And in our situation, we've taken places have had lots of homemade tools, spreadsheets, smart sheets, things that exist on, in Excel, but that are then filed away and are only available to the people who have access to that drive, so very limited access. having a cloud-based system allows us to take, as Kevin has said, all of the data from the enterprise-wide systems, as well as the data that's entered by the Frontline, to make a full picture of what's going on in the hospital or the clinic in any particular moment. So surgical services wants to know where are they on their plan for today, and what were they actually able to accomplish in terms of cases and block fill and having gaps in the schedule. They can have all of that information directly available to them and know its correlation with their staffing, so they know whether or not they're managing to the volume that they're actually experiencing.
So you actually cut through the silos, it sounds like.
We do. We integrate internally. We sort of joke, I call it the cotton gin. We have all of the data sources, and then it gets mixed together and takes that individual pieces of data that can overwhelm anybody and makes it into information.
That's great.
So, very simply, like on a nursing unit, it can take, they usually had grids that told them, if you have this many patients, you need this many staff. We can cut through some of that and say, okay, if you have 20 patients, but 5 of them are 1 to 4, and the other 15 are 1 to 5. Now, how many nurses do you need? Because you need to staff differently based on the acuity of the patient.
Okay.
And so in the end, it can tell you that your matrix prediction was correct or incorrect. And if you've staffed, even in a staffing matrix, if you have an odd number of patients, if it's a 1 to 5 ratio, but you have 17 patients, you still have to staff those other 2, right?
That sounds like
you can
an SAT exam question for me, but
right, yeah, I get that. But it can tell you right within the tool, okay, and you have the ability to accept 3 more patients without changing your staffing.
That's really cool.
So it's a direct information link for frontline staff who, in a 24-hour operation, you don't have managers managing 24 hours a day. Yes, they're accountable, but they're not there making the decision. So you want tools in place that can help support them in making that decision.
Okay.
And that's what this does.
Well, Kevin started to answer this question, but I think there's some more parts to it. So let me ask it again. Healthcare workforce management is full of inefficiencies. And you've identified 4 major challenges that Perfect Shift solves. Kevin answered one of those. Can you address?
I can address the others. So in addition to the data deficit, making that data into information, it also provides a way to make coaching much more effective. You're not talking to a group of people and talking about what some of them may have done. You're talking to individuals based on what they put into the tool and said, so help me understand how you went about making the decision in this circumstance. Goofy examples. In the nursing units, they enter this data every 4 hours. So each charge nurse enters 3 timestamps. And I have seen instances, not infrequently, where somebody gets very efficient and just chooses the middle number of acuity. So I have 1 to 2, 1 to 3, and 1 to 4 patients, and I just put them all in as 1 to 3.
Yeah.
Okay, interesting, but it actually comes up with a different answer about how many people you need. And on the shift before it and the shift after it, the patient acuities were well documented. So you can not just talk to all of the charge nurses about the importance. You only have to talk to the one charge nurse about how they're performing. So you have the opportunity to really impact performance and performance coaching. And the other thing it does is it provides you with performance tracking over time, which now you're going to the next level of leadership and the way I describe it is it's a tool that's important to use in all one up and one down meetings. So if I'm the manager meeting with my charge nurses, I want to tell them about the impact of their work on our department's performance. If I'm the director meeting with a manager, I want to check with them how closely they're aligned with their budget and what their strategies are, but I have real-time data to do that. So when they tell me some circumstance in their life, they have a patient who requires more care and they've had him for 6 weeks, or it's within the pay period, I've had him for 7 days. Well, I've actually got the documentation about that need, so I know what it's about, and we can use it. When the director meets with their VP, they take all of theirs with it. They pull up on a screen all of their areas and show them performance. So everybody's doing coaching based on real performance and trended information.
Okay.
And then that implies the last of the four, which is organizational transparency. Everybody has access to the information. So if someone's doing really well, you can go chat with them about how are they managing that.
And obviously, if somebody's not doing well, you can also try and figure out where the deficit is.
You can, and you understand that not only you and your director are going to be able to see your performance, but everybody else can too.
Yeah,
So there's a little bit of peer pressure to
competition there.
get on it. Yep.
Good. Well, let me go on to the next question. Could you explain how Perfect Ship's cloud-based platform aggregates data and the types of insights it provides to frontline managers? I think you talked a little bit about it, Susan, but Kevin, if you could address that one.
Sure. I'll hit one part of it in particular. One of the ways we ensure efficiency is through our approach to data security and integration. And unlike direct API connections, meaning you've got a direct connection into a system, a particular system, and you're gathering data in real time, we don't go about it that way for a couple of reasons. One, it burdens the host systems and exposes them also to security vulnerabilities. So we want to minimize that as much as possible. And then we also use an encrypted secure file transfer process, which keeps the hospital systems protected while still ensuring seamless data exchange. And then we all know that compliance is critical in healthcare, and none of the data we receive contains patient identifiers. In other words, HIPAA-related information to make sure that we're in compliance there. For the type of reporting and analytics that we provide our clients, there's really no need to have that patient-level data in the system. And we're able to track patient flow and things like that with anonymous identifiers that help us track instances of like emergency room visits or procedures in the OR, et cetera. But yeah, in terms of insights, frontline managers have access to a lot of critical operational matrix throughout the day. But Susan, do you want to go into that one?
Sure. So we work in a variety of states, but several of the ones that we are currently working with are state mandated ratios. So one of the things that the tool documents every 4 hours is that the staffing ratios are being maintained and easy to see at the landing page. Because we do this tool with those inpatient units every 4 hours, lots of time intervals to be able to compare. They're also able to compare staffing variances to expected demand. As I was saying, they can look to see whether or not they can accept more patients or whether or not they need some help from the staffing office to be able to maintain their status. And then, so that's the readiness to accept and readiness to discharge. The 4 hour cycles really synchronize well with decision making in real time if you need more people, if you can send people home early, which oftentimes people are able and willing to do. the access to the, as Kevin was mentioning, some of the more elaborate tools like the time and attendance tool, that is one that gives them some incredible insights about performance. Things like the use of incidental overtime within any period of time, graphically by employee. And incidental overtime is that 10 to 15 minutes at the beginning or end of a shift, and it ends up costing in a large organization an incredible amount of money. So it's a very important thing for managers to be able to track.
Gotcha. Let me skip to one last question. What sets Perfect Shift apart from other workforce management solutions in the healthcare industry? Kevin, you want to take that?
Sure, I'll take that. It really comes down to our commitment to frontline engagement. Many workforce management tools really focus more on administrative oversight, but our platform was designed for the people who are actually running the hospital units day in and day out. And rather than just offering another data dashboard, Perfect Shift actively helps frontline leaders improve how they run their departments. We provide the right information at the right time in the right format so they can take action immediately. Our belief is simple. Technology should support human decision-making and not replace it. That's why our focus isn't just on analytics, but on coaching and empowering leaders to make better decisions in real time.
Well, that's great. Unfortunately, guys, we've run out of time. 15 minutes goes by pretty quickly, and this is no exception. I want to thank you both for really giving us a great insight and being and a stimulating discussion. That's really what this is all about. I think the audience learned a lot about small business, medium-sized businesses, and how you guys are working with those kinds of healthcare companies to help them become more efficient and effective in a lot of different ways. That's terrific. How can our listeners contact you if they want to talk to you, if they want more information or get?
Sure. The easiest thing to do is just simply go to our website, which is perfectshift.com. And there we've got our, you can contact us via email, you can call us on the phone, whatever's more convenient. We also have a very brief but effective overview video of our company. It's right there on the landing page. You can spend 2 minutes and watch an overview of what our solution looks like and does.
Just to make sure that the company name is clear, it's perfectshift.com. So, I know these guys would love to talk to you.
Absolutely.
Don't miss the next episode of Technology when we'll discuss how technology is changing some different business segments. Remember, you can always find Technology podcasts on Apple, YouTube, Spotify, Amazon, and SoundCloud. And if you need help with any size technology challenge, please contact Performance Business Services at performancebiz.com. I'm your host, Ken Umansky, and until we meet again on another technology podcast, keep innovating.